Mind just giving me a little bit of background, just so I can get to know you a little bit?
Yeah. So my name is Francis. I'm originally from Bakersfield, California, but I moved to Massachusetts in 2019. I moved to Massachusetts to attend the 4-year accelerated DNP program, or RN to DNP program. So in a year, I completed my RN. I got my RN license, did the 1-year accelerated program, and then now I'm entering the DNP part, where I am already in the DNP part of my my curriculum, and for fun, I like to go surfing. I like to go scuba diving. I like going to CrossFit, working out, staying as healthy as I can.
Yeah.
But during my time off and hang out with friends, and my family's all in California, so I try to visit home as much as I can, given the pandemic that we have. And then for me, as far as my aspirations in my career is, I hope to achieve to become a cardiothoracic surgery first assist NP,
nice.
Which is why I'm also part of the. I just became admitted to the surgical first assist residency at UMass Medical School. So I will be doing my residency this year. I'm actually starting next week, like the didactic portion of it, and then I'll be proceeding to doing the OR preceptorship next spring. And then I'll be returning back to my DNP study. So I actually had to take a year off from my regular DNP curriculum. I'll be graduating a year later than my classmates, just because I'm taking this extra time to do this residency. Yeah.
Nice. Wow, you sound busy.
Yeah, I guess so.
That's awesome though. That's cool that there's so many programs that exist now that like do all those overlaps, so you can really fine tune, where you want to head to. And I know we're going to talk more about that in the interview as well. So, are you at Worcester?
Yes, I'm in Worcester,
Okay.
And I go to UMass Medical School. So the UMass Medical School is made of 3 schools. It's the medical school, obviously, and then there's big nursing school, and then the biomedical sciences, which is basically like the PhD and the research folks. So. Yeah.
Cool. Yeah, I grew up in that area, so I
did.
Yeah.
No way.
Yep. Not right in Worcester, closer to Boston, but in Needham. Yep. So.
Oh, I work in Needham right now. Actually.
No way.
Yeah.
Oh, funny.
I work at Beth Israel. And,
okay. Yep. Yep. The whole time. I mean, I haven't been back there. My parents moved in '97, and then I was off, in other parts of the country at that point. But yeah, now when I go back, it's so different from how it was when I was there. But
oh, nice.
My old stomping grounds.
So where do you live now?
I live in Florida now.
Oh, wow. Very big change.
Yeah. I was in Colorado for like a decade, and then I thought I'd just be out there forever. And then I met my husband in nursing school when I went back to New England, and he was from Florida, and he just didn't make it through the winters.
That's cool.
We relocated down here, and I've only practiced in Florida. So,
oh, nice. Yeah, the winters are tough here. I'm discovering, and I've only been here for 2 years. So.
Water temperature is probably about the same for surfing, but the air is a little bit different for sure. Cool. Well, let's jump right in if you don't mind.
Yeah, no worries.
I have sleeping babies, so I like to take advantage of the quiet time if I can. But thanks for doing this. We really appreciate it. And it's nice to have so many different voices. And I love talking to people that are in school too right now, because I feel like you guys are the most tapped in and the most passionate about nursing. So that's a great perspective to get. So you mentioned you're in the surgical NP track. What is it like to be in that track for maybe people that or I guess if you could explain maybe what that is for nurses that might still be in school, or new nurses, and what made you pursue it specifically?
Yeah, so to go in that surgical track, you have to get the certificate, which is called the RNFA, which is basically the Registered Nurse First Assist. You can be a first assist as a nurse, but you can also be, my goal is to be a first assist as an advanced practice provider, as an NP. And so you typically go through, it's usually a 1-year program. I know the big overarching national organization, NIFA, offers that to students, but I chose to do it through my school just because it was convenient, and UMass Medical School is actually the only school in Massachusetts that offers that program.
Oh, wow.
And it just like was so convenient that it happened to be in my school. And for me, I actually, my story is a little different, just because I actually started out as a family nurse practitioner track. Because before I thought what I wanted to do as an NP is, work in primary care, take my time with my patients. And then I realized through my clinical rotations in nursing school that, and then reflecting back on my life as well, back in the day, which I will touch upon soon, is I realized that my true passions lied in the acute care setting in the hospital. And then I realized that before I moved to Massachusetts, actually, my mom has a common heart condition called atrial fibrillation, which most, all nurses know. And, it was manageable, it was fine. And then my mom eventually was recommended to have an ablation surgery, which is also a pretty typical surgical procedure for AFib patients. However, her procedure went in the wrong way because her esophagus was accidentally nicked during the procedure. So pretty much everything went downhill. She had a 12-hour corrective surgery that was 85 to 90% mortality rate. She had to be helicoptered into to UCLA, which is like the closest level 1 trauma center that specializes in cardiothoracic surgery. And because of that, she was in the hospital for 4.5 months. She was in the ICU for a month. But it was during the ICU when I was taking care of my mom, because I'm the only child, so I pretty much stepped up to take care of my mom. My dad has no experience in the healthcare field, so it was pretty much me handling everything, especially medically, medical stuff. And basically, when I was taking care of my mom, one of the biggest things my mom suffered from post-surgery was nausea and vomiting. She actually lost 35 pounds. Wow. In addition to the procedure, just post-surgical, because every single day she would pretty much vomit twice a day, and she couldn't hold anything in. And a lot of the surgeons would try to figure out they would tweak the medications. They would maybe start her an amiodarone drip. Maybe they would change, they would just change a lot of medications throughout her experience. But it was towards the last week of her time in the ICU that the 2 nurse practitioners who specialize in cardiothoracic surgery spent maybe an extra 45 minutes just kind of assessing my mom, taking time to see, what else could be going on, like why is she having these reactions? And they eventually found that it was because she had an NG tube in her, so they eventually found that it was the feeding tube, the content of the feeding tube was too dense. And then when they realized that, they reported back to their attending physician, and then lo and behold, my mom's nausea and vomiting was fixed. And it was at that moment that I think it kind of woke me up, and I was like, and I even asked the nurse practitioner, I remember asking them specifically, like in my mom's room, I was like, what do you do? Like, how did you figure this out? And she was like, well, I like to take a step back and re-examine my patients, but beyond their medical condition. And so I think that was one of the most powerful things that really affected me and why I'm even in nursing in the first place. And so when I went through my clinical rotations, and then I would reflect back, because in nursing school, they love making you do reflections, right? So when I kept reflecting back, and then after a year, I kind of talked to a lot of faculty members and a lot of my peers, and I made the decision to change my track to acute care and specifically pursue surgery. And so with that, I decided to pursue that route. And then unfortunately, because of a huge part of the problem that the COVID-19 pandemic has presented for a lot of NP students around the nation is clinical placements. And so normally I would have graduated with my classmates as well. Usually I would do my surgical residency actually my 4th year. But because of the lack of availability of clinical placements, I've had to take an extra year. But luckily, my program was very flexible and let me do my surgical residency this year. But yeah, that's why I'm now headed on this track. And then, like, I guess my experience as a surgical assist NP student, it's pretty difficult, to be honest. It's very overwhelming because there is not a lot of resources out there.
Wow.
No one in my school, I mean, there's first assist NP students, but no one has done the cardiothoracic surgery track.
Yeah.
So preceptors, I've had to look on my own.
Yeah.
Just trying to navigate this whole experience. I'm the only one out of my whole cohort that is pursuing this route.
Wow.
So it's been a little daunting and overwhelming. But I always had to remind myself that this is exactly what I want to do.
Right.
And so I had to remain driven and motivated to keep going. And luckily, you know, after interviewing, I'm not even kidding, maybe 35 to 40 cardiac surgery programs around New England, calling every single one, asking them for a chance to kind of, you know, give me a preceptorship, a first assist residency preceptorship. One hospital in Fall River, Massachusetts, South Coast Hospital, decided to take a chance on me, and and that's where I'm actually doing my residency this spring.
Oh, cool.
So I'll be training under the chief of cardiothoracic surgery, directly under him, and with the hopes of working with them after I graduate from NP school. But yeah, so it's, I guess, for the people who are, you know, for aspiring NP students who want to pursue that route, be prepared for a long road and kind of just like navigating it through your whole on your own, which is why it inspired me to start this YouTube channel, because I realized that I've had to give a lot of advice to multiple students in my program who are younger than me, or in, you know, the younger class below me, and even just family and friends that are kind of interested in that field, who, you know, trying to figure out what they want to do. Yeah. And I realized that there's not a lot of information out there for first assist NP students. So it kind of gave me the inspiration to start this YouTube channel so that I could reach people at a broader scale who are thinking about this field, or who don't even know about this field. Yeah. And NPs specifically, there's a very low percentage of NPs that work specifically in first assist as first assist, because most of them are actually PAs and MD and DOs, right? Which we all love, but it would be nice to have a larger representation of NPs in that field.
Yeah. I think your example with your mom perfectly illustrates why that's so important, you know, because in surgery specifically, you're so pinpointed on things. Yeah. And it's nice to have someone that can dial back and look at the holistic picture. Definitely comes in handy. That's amazing. And I love that you're kind of like a pioneer in the field and are already giving back to people, like you said, that are going to follow in your track or in somebody else's track. And I'm sure it's super helpful to have a resource, you know, even if it's just how to go about being the first to do something. Yeah. That's super daunting, and I bet a lot of people would, you know, it gives you a lot of opportunities to quit when like you said, it gets overwhelming. That's cool. Thank you for giving us all the details on that.
Sorry if I went on a little tangent on
that. No. I'm a detailed person. I love hearing. I love all the backstories. I'm going to switch gears a little bit and go to the topic of cultural competency. What does that mean to you as a nurse, being in school right now, what your experiences have been in practice so far?
Yeah. I'm very thankful I've had training at UMass Medical School that really does pride on looking at the patient beyond their medical condition, and really taking into factor everything that dictates the patient's disposition. You know, you look at the socioeconomic status, you look at everything beyond, basically, that a patient presents with beyond their medical condition. I think combining my my educational experiences along with my experience working currently as a nurse, and especially now in a very politically heavy climate, and just in a very triggering climate now, especially in the scientific world and the clinical world, I've learned to, and I admit there's definitely times where I get frustrated, treating patients, but I always have to remind myself that it is very important for us as healthcare providers to let go of our biases, because once you have that bias, whether it's positive or negative, it automatically dictates the care that you're going to be providing. And I think it is our duty as healthcare providers to let go of those biases, to look beyond those biases and maintain as much neutrality, yet still be empathetic to the patient, which again is easier said than done. But I think that's the only way that we can properly treat our patients. And you know, in addition to that is whenever we treat a patient, I think it's important for us to take their cultural background, whatever it may be, especially if it's something that, you know, that we may not agree with. I think it's still important to kind of take that into account and try to really customize the care for that patient. And I think when we learn to customize that care more intentionally, I think our patients become more active in their own patient care, which I'm a heavy proponent for patients taking an active care, you know, an active stance in their own care. And I think that's the only, you know, that's the best way that at least I found in my background. So
I 100% agree with you on that for sure. How do you feel that online communities like NurseDeck specifically could benefit you in your career, especially you being a student right now?
I think something that's really cool about NurseDeck and just online communities in general, like I said earlier, like I often felt alone in this journey, just because I had no mentors, I had no that went through this exact route. And so I think having like a community where I can share my experiences with people and be able to kind of go back and forth in healthy discussions about what it's like to navigate this space, even just as a nurse working in a pandemic world. I think having online communities is very important because it's a way for us to kind of, what do you call it? Like share in each other's experience. And I think that's one of the steps in terms of preventing burnout, which I think obviously nurses are really suffering from right now, all across the country. And I think with this opportunity to, you know, share with each other's experiences, I think it gives us, it reminds us that we're not alone. But it also gives us what I love about sharing with experiences with other people is that I get to hear about different types of perspectives about how they dictate their care. Maybe something I've learned, you know, like if I listen to another nurse or somewhere out in the community, we're like, oh, this is how I do my things. This is how I do my care. And I was like, oh, I never thought about it that way. And so you kind of have a healthy exchange of ideas. So then it kind of, you know, improves your care towards your patients for the long run. And I think within an online community like NurseDeck, you know, if I'm able to spread my story, kind of use this online community to share my experiences and be able to inspire other people who may be pursuing this route, you know, I want to encourage more NPs to be in the surgical route. And if I can even provide guidance towards other people in this community, that, you know, I feel like I'm doing my job already.
Definitely. Yeah, that's awesome. I think if we can send people back out into the world a little bit more resilient and connected than they felt coming in, like we've done our job. So that's awesome to hear that it's being received and used in that way. This is kind of a loaded question. You could go anywhere with this, but what do you feel like is the state of nurse today? Being a nurse, nursing, however you want to answer that.
I'm sure like every other nurse in the nation or around the world, in the matter of fact, there's definitely a state of, I think we've passed the beyond the point of being overwhelmed, but rather we are now entering the stages of burnout and kind of just like being frustrated with the system, with how, or just like, you know, just how the system and how the government is handling the pandemic and how we need to do better to treat our nurses better. Obviously the patients come number one, but if the healthcare providers are not being taken care of, how are we going to provide care for our patients? I think that's one of the biggest challenges that that infrastructures and systems and are kind of going through. But I think that's where innovation comes up a lot. And I think there's, for example, in my hospital at Beth Israel, they're trying to come up with different types of methods to kind of encourage nurses to not be so burnt out at their job, you know, to really take the time outside of work to spend time with their family. They even have an application, a phone application that allows you to practice mindfulness and do yoga on your own time. I think that's where we are currently right now, is that I think I hope that we find ways to improve the nursing experience, just because this is probably one of the questions that you were going to ask is, do you find nurses leaving, you know, the field? I don't see nurses leaving the field per se, but I see nurses leaving institutions for better institutions, because I think nurses nowadays are learning to fight for themselves and to advocate more for themselves, because they realize that healthcare systems are not doing a good job in helping nurses, you know, be, you know, in this field. And so I think that's where I'm more proud in the nursing field today, is that nurses are taking a more active stance in terms of how they want their lives to be, and how they want, you know, that they don't want to burn out. They don't want to stop working, because, you know, more and more, I guess there's research now that's showing that younger nurses are, you know, new graduate nurses are already feeling burnout. And it's not just the nurses who've been working 10, 15 years, which is scary for the nursing field, because we need more nurses. We need
that young blood.
We need retention. Exactly. We need, you know, how are we going to treat the aging population if we don't even have nurses to begin with? So
that's so true. Yeah, I think that's exactly right. And wouldn't you agree that, I think before, like you said, the leaving of institutions, I think that happened on a micro scale before, but now that it's happening in mass exodus numbers, institutions can't ignore the problem, because they can't function without nurses to take care of this huge influx of patients. So I think that's a really good point to bring up. So
and I experienced it myself working for a previous institution that had one of the biggest nurses strike in the nation, and they're still going on strike right now, so with 700 nurses out of work. Because
is this in California?
No, this is in Massachusetts.
In Mass, okay. I was gonna say, you see both of those states in the headlines a lot. So.
And so
good. They're good at organizing.
Exactly. So it's you know, it's real, it's happening, and I think it's a duty of healthcare institutions to take care of their nurses better. But I think most importantly, to end that question, I think being a nurse is still ultimately the most rewarding thing you can do, just because, especially now in a very troubling, you know, climate in terms of clinical medicine, I find myself even working directly with COVID patients, that just having someone there taking the time to take care of them, I think is something that we all need, especially during these troubling times. So
I agree. I think you sort of already touched on this a little bit, but as far as the future of nursing in a hopefully post-pandemic world, if we ever get there, or a pandemic adjacent world, where do you see the future of nursing?
I think beyond obviously the you know, trying to find innovation in terms of preventing burnout for nurses, I think just innovation in terms of evidence-based practice medicine in nursing is also exploding. I'm seeing a lot more nurse entrepreneurships, which is pretty encouraging for someone like me, because I'm trying to be a YouTube vlogger and trying to navigate that space. I'm also really interested in research and also healthcare entrepreneurship. And so I think more nurses are thinking more creatively, are thinking more holistically, I guess
Yeah.
it's like that word is so overused, but it's so true.
I know.
I think nurses have that gift, and I think it's really cool to see nurses kind of take medicine an extra step up, especially utilizing the technology that we have today, or that are at our disposal.
Yeah.
And I'd hope to see more nurses becoming entrepreneurs and kind of changing the world in medicine.
Right.
Yeah. So.
Yeah. Well, I think you sort of have already answered this as what would be a good reason to tell nurses that are thinking of leaving the field to stay. But I think you touched on that with it's always been true. I think that nurses can, if you get burnt out in one area, you can always try something else. That's one of the best things about nursing in general. But I think there's this whole field that is like largely untouched that you mentioned, like the entrepreneurship, and different levels of nursing innovation. So I love that you brought that up. Any other pointers for nurses that are like, forget this, I'm over it, I'm going to go work in a cubicle, never talk to people again?
I think it's definitely for nurses who might be thinking of leaving the field is don't be afraid to express your concerns to not only your peers, but your managers and the people who are quote unquote of higher authority. Yeah. I think when you let your voices be known, you'll be surprised by how much leadership will listen to their employees. And even if they don't listen, ultimately, at least they know that what the things that you're struggling with, so they can try to work around and see what kind of resources they can provide for you. And I think, and then just again, like online communities like this, or even just like at the workplaces, I think, don't isolate your concerns. Don't isolate anything just on you. Like, you have to be able to share with other people, because just by even just the action of sharing with other people, I think it already offers this kind of therapeutic effect for people. And then, if you have someone that, if someone responds, but like, oh my gosh, I'm feeling the exact same way, then you kind of already have this bond and you feel like you're not alone. So
exactly. Yeah. Especially with the hard stuff, for sure.
Exactly.
In that same vein, the overwhelmed and overworked feeling that I think nurses already had before 2020 hit, how do you think that has increased since the pandemic? Do you think it's just like working more hours, being on your feet, having crazy patient loads, or do you think it's more like the existential kind of doom that you feel even when you clock out?
I think it's a little bit of both. Yeah, it's again, I think we're past beyond the point of being overwhelmed. But this is me. This is my anecdotal experience based on my own experience, and then just my my colleagues' experiences. Like, working with, so that just because what I'm saying doesn't mean that it's a reflection of what other nurses are feeling around the nation. But at least for me personally, I definitely feel overwhelmed. I actually had just this Friday night, Saturday night was one of the craziest shifts I've ever had. And it was because there was just a lack of personnel, lack of staff, and then it was a pretty high patient load. And it's such a hard question. It's like, yes, I feel overwhelmed, and I feel, I think that at this point, I'm just feeling pretty frustrated with just how things are. And and there's times where I'm just like, I just have to push through this night, and I'll be asleep eventually at home. But again, it definitely just helps to be able to share my frustrations with my colleagues, and not being afraid to ask for help. I think before, especially now, like, when you're treating non-COVID patients, you can go in and out of the patient room. But now with COVID patients, you have to cluster all of your care at once. And there's one of the most frustrating things, minute things that I get frustrated with, is I forget my medications in the med room, or I forget like one of the meds, or I forget like an IV tubing, and I'm like, oh my gosh, I have to don on and off again to go get this stuff. And then like I have to properly don on and off my equipment because I don't want to put myself in danger as well, or put my other patients in danger as well. So I think it's just those types of frustrations, and
yeah, they're magnified.
They're just yeah, it's a very trying time to be a nurse. But yeah. I still find the smallest rewards in my work. So I think that's how I keep going in my work, despite the exhaustion that I feel throughout my shift or throughout my experiences as a nurse.
Do you feel like you have to force yourself to focus on those things, the small, like you said, the small little moments, or
yes, definitely,
like make a practice of it?
Because especially like with shifts nowadays, I feel like there's no time. That's another thing. I don't think nurses these days are taking their 30-minute breaks, their breaks seriously, which is pretty. And I couldn't even take one like recently, just because it's just becomes too crazy, and you're always thinking my patient comes first. But I have to remind myself that I'm a human being and I'm not a robot. And if I need to provide safe patient care to my patients, I have to take care of myself first.
Right.
So I think, yeah, like I have to force myself to like, hey, you need to take a break right now and eat your dinner, or eat, or just kind of like, hey, like your patient expressed gratitude to that. I don't force myself, but I consciously make the effort to recognize that. So that way, then you start recognizing your work, and it just helps you prevent that burnout. So
no, I think that sort of leads into my next question. And we touched on this a little bit too, in terms of self-advocacy, but I think, there's like the big self-advocacy, like speaking up to the higher ups. And then there's the self-advocacy you were just talking about, which is like the self-care aspect. Is there anything else you want to say about self-advocacy, and have you seen a stronger sense of self-advocacy from your colleagues and fellow students?
Oh, definitely. Yeah. People, I think nurses and, nurses in general nowadays are just more adamant about their vacation time, especially because a lot of them didn't get their vacation time last year. And when nurse managers, when managers or higher ups are not apt to giving those, nurses are definitely fighting for that, which I'm very happy about, because we deserve those vacation times. We deserve those times to take breaks beyond our work. And again, just like institutionally, I'm seeing more nurses advocate for themselves, but I'm also seeing a lot of advocacy for their patients, which is obviously that's been something nurses have always done, but I feel like even more nurses are advocating for their patients, especially when they recognize that the disposition of the patients is not the patient's fault, or actually most of the time the disposition of the patient is a congruency of multiple factors. And I think nurses nowadays are more holistic in terms of treating their patients well. And if they don't agree with, for example, how a provider is providing their treatment, nurses are more apt to fight for that for their patient as well, which is very encouraging. Yeah,
I love that too. How that nurses are sort of seeing the big picture, like you said, the systems that people are involved with that are beyond their control. Have you felt that your bond with your colleagues or your students has been affected by the pandemic? Do you feel like it's stronger, weaker, changed in meaningful ways?
Definitely a lot stronger. Especially when my nursing class, we were the first class that had the peak of the pandemic. And so we were the first class that the whole curriculum transitioned to Zoom. And then from there, we started our clinicals during a pandemic. Actually, our clinicals were closed for like 2 months. And then eventually they started, accepting students back into the hospital. And then now we're all nurses, and we're all pursuing the the NP route. I think just this having the ability to share in each other's experiences, I think, and I think just like any other adversity, when you go through it together, you come out stronger. And I think, and I definitely feel like my cohort or my friends even my colleagues at work, that we're definitely family. That we're family. Sorry.
No, that's so true. And that gives me hope for the nursing students coming in, as like, at least they have each other.
Yeah, exactly.
Hopefully they'll all stick it out together. Do you think communities like NurseDeck can help with these bonds and help to build upon the relationships that you're making belly to belly?
Oh, definitely. And I think, like I said earlier, online communities, just offering that chance to share each other, is really cool. And hopefully I'll be able to, with the NurseDeck community, it'd be really cool to kind of network with people.
Yeah.
Maybe there are people in Massachusetts that are part of this community, and it would be nice to, connect with them, see how they're doing, see what kind of things, experiences that we can share with each other, and be able to offer advice to each other, and to see how can we, better our status as nurses. Or if, especially if we pursue the advanced practice provider route as well. Yeah,
I love that. Like building connections in real time. I think that's awesome. Well, I think we're wrapping up. Is there anything that you'd like to touch on that we didn't talk about, or any issues that you feel deserve a little bit of a spotlight?
I don't think in terms of issues, but I definitely, with shameless plug for my YouTube channel.
Yeah, no, go for it.
I think it's like, so for those of you that don't know who I am, my name is Francis, and I have a YouTube channel called Sabas in the House, which just launched 2 weeks ago. And I'll be loading videos about pretty much my journey as a first assist NP student, kind of offering advice. I think I would like to harp on the issue that, but I'd like to encourage more nursing students or aspiring NP students to pursue the surgical route, because there's definitely a need for a bigger presence within the surgery field for NPs. And I think it's just, hopefully with my YouTube channel, I'll be able to offer advice. I would also, on my YouTube channel, I'm also creating a series that will challenge medicine, how we as healthcare providers can provide better care for these type of patients. So I'll be featuring patients who are diabetic patients who are veterans, LGBTQ plus care, and I just like to get the conversation going, because I don't think there's a lot of conversation out there in terms of how we healthcare providers can improve our care for those types of for all sorts of patients. So that's about it.
That's awesome. No, I think that's great. And I think coming from a nurse, I mean, my background's in ER, but I feel like the OR is so much shrouded in mystery for other bedside nurses. They're like, I don't really, if you want to go into the OR nursing, you're like, I'm going to be starting from square one. So I love that you have a channel that kind of goes in like the day-to-day stuff that you're doing, like as a student and in your residency. And I think that's going to encourage a lot of people when they see what you really do, the details of it. So it sounds really cool. We'll definitely have to check it out. Cool. Awesome. Well, I think that's all I have for you. Thank you again for your time. I know you're super busy, and hopefully you got some good rest after your hard shift this weekend. So,
so my question, I guess, would be, like, I saw online that we can apply to become scrub verified. How do we go about that route?
I have an email address that you could like start that process. There's also, I know that's sort of like a newer thing they're doing with like this ambassadorship program, and they're building like a separate channel with it. But I bet Gabby would probably know exactly like the person you need to talk to. But yeah, I can get you at least email address, and then I think I know they're like, we have this whole thing where we were doing like an in the field profile. And I know they've pulled people from there to kind of be the first voices of it, but have you done any of that? Did you do an in the field with us?
No, not yet.
That one, you can at least go on just to the regular NurseDeck site. And if you like search query the in the field, or if you go down to the blogs, there's one posted like every few days. And then there's a little button that says get heard, and it takes you to like a questionnaire. So you can start there too. And then at least we have like all your contact information to pull from. But I bet Gabby would know the answer to that. So better than me. So
I'll shoot Gabby an email.
But definitely that's definitely a new thing that we're building up that's been well received. So
awesome. Very cool.
Exciting. Yeah. All right, cool. Well, thank you again.
Yes,
and I think I am gonna sign off here. Enjoy the rest of your day.
You too.
All right.
All right. Bye-bye.
Nice to meet you.